WFM 91.7.
Good morning. Thank you so much for staying with us right here on Women Radio WFM 91.7. It's about 5 minutes after 10. How is your day going? How is your day starting up? How is the week starting up for you? I hope you're feeling good today. You're feeling great. You're feeling energetic. You are feeling great health-wise. Like you feel like, you know what, with this kind of health, with the kind of feeling I have this morning, I can go ahead and conquer the world. So I just hope that is the same thing you have in your mind. Honestly, I just hope so. All right, so thank you so much for staying with us on Women Radio WFM 91.7, and of course you're welcome to the program Radio Doctor, your free health consultation program where real doctors advise real people. All right, thank you so much for joining us this morning. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advice on radio on your Women Radio 91.7. Radio Doctor comes to you from Mondays through Fridays at 10 a.m. My name is Rose Yusuf Kaiser. All right, and today on Radio Doctor, I have Dr. Olufumilola Akinola, a consultant pediatrician at St. Ives Family Hospital. All right, so she will be consulting with us this morning. And hopefully you get to join in the program too and ask your questions. Today is for children's health. That's what we do every Mondays. Children's health on Mondays, and of course on Tuesdays we look at women's health. On Wednesday also we look at your general health. So we have different days, for different specialty just for you. All right, so yes, this is Women Radio WFM 91.7 at 6 minutes after 10. And like I said, my name is Rose Yusuf Kaiser, and I have Dr. Olufumilola Akinola, a consultant pediatrician at St. Ives Family Hospital. Good morning, Dr. Akinola. Thank you so much for joining us. Hello, Dr. Akinola. Okay, I think she's joining us virtually, so I guess we kind of lost the connection there. We'll try to reconnect with her this morning, so hopefully we get to have her back pretty much soon. All right, so yes, today is Monday, the 16th day in the month of October 2023. Hoping that you're feeling very healthy this morning. How's the weekend for you? How have you been all through the weekend? I'm hoping that you were able to do your exercises. I'm hoping that you were able to do something, for your health this weekend. Were you able to take that fruit you told yourself you were going to take? Were you able to do that smoothie, from fresh fruits that you told yourself, what, this weekend I'm going to start it? Were you able to do all of that? I'm just hoping that, you're able to do it, because we are so good at saying, I go do them. I go start them very, very soon. I go start them. But hey, how about your children? We're able to take them out, because sometimes we tend to forget that. Sometimes we tend to forget that. Children also need to go out for this exercises. Children also need to be carried along, because sometimes what you start with them early enough, you get to they get to grow up with that. So, and then they get to continue in that particular way. So it's only good for us to make sure that they are trained in that aspect, so they can start exercising from young, and when they grow they will definitely keep up with that. So I think it's all on us. All right, this is Radio Doctor on Women Radio WFM 91.7. So let's see, Dr. Akinola, are you with us now? Good morning.
Yes, good morning.
Good morning. Thank you for joining us.
Good to be with you.
All right, how's the weekend, Dr. Akinola?
Pardon?
How was your weekend?
Yes, my weekend was fine. How was yours too?
Oh, well, it was good, but a bit busy. But, thank God for life. All right, so you're welcome once again. Thank you so much for joining us this morning. So today on Radio Doctor, Dr. Akinola will be consulting and advising on seizure disorder in children. All right, seizure disorder in children, that is what we will be consulting about this morning. All right, so that's the topic for today. All right, so do well to be a part of the program by dialing 07000 917 917. Send a text or a WhatsApp message to 070 317-565-37. We have Dr. Olufumilola Kinola, a consultant pediatrician at St. Ives Family Hospital, consultant with us today, and she'll be consulting and advising on seizure disorder in children. This is 10 minutes after 10, and this is Women Radio WFM 91.7. All right, so let's go ahead and start up with seizure in children. Now, let's not forget that you can follow us on all our social media platforms: Facebook, Instagram, X, and YouTube at WFM 917. You can also log on to our website www.wfm917.com to listen live from any part of the world. You can also download our mobile app WFM 917, and of course, you can get to also listen to us from any part of the world. All right, seizure disorder. So, Dr. Akinola, kindly let us know what seizure disorder is.
Thank you very much, though. I want to start by saying that a seizure occurs when one or more parts of the brain has a burst of abnormal electrical signal that interrupts normal brain signal. Therefore, in seizure disorder, the brain electrical activity is periodically disturbed, resulting in some degree of temporary brain dysfunction. So anything that interrupts the normal connection between the nerve cells in the brain can cause seizure in children. So, and this includes high fever, high or low blood sugar, alcohol or drug withdrawal, and brain concussion. So, when a child has 2 or more seizures with no known cause, this is described as epilepsy. So, in summary, seizure disorder is when there is the periodic disruption in the brain electrical activity, resulting in some degree of temporary brain dysfunction.
Okay. Thank you so much for giving us, the definition of, or rather, what seizure disorder is. All right, this is Women Radio WFM 91.7. Now, to be a part of the program, you have a question you want Dr. Akinola to answer on seizure disorder, please do well to dial the number 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. All right, Dr. Akinola, how common is seizure disorder in children? How common is it?
I didn't get the right statistics, for this part of the world, but it's fairly common. And you see a lot of children presenting in a healthcare facility with seizure or seizure disorder at one point or another.
Okay. All right. Thank you very much for that, Dr. Akinola. Now let's look at common signs and symptoms of seizure in children. So what do we look out for? How do we know that this is a seizure? How do parents or how can guidance actually watch out for the signs or the symptoms of this in children?
Thank you. In children, symptoms and signs of seizure depend on the type of seizure. There are different kinds of seizure. We have tonic-clonic, we have partial seizure, we have absence seizure, which I don't want to go deeply to that. But the generalized symptoms or warning signs of symptoms in seizure include jerky movement of the arm and leg. You may suddenly notice that the child that you are playing with, or probably one that is sleeping, suddenly start having jerky movement on the limbs of the limbs. It may be it may affect all the limbs, the upper and the lower limbs, and it may also affect probably one part of the body, maybe right upper limb or lower limb, and sometimes it may be missed. So the first thing is jerky movement of the arm and leg. Then they may also present with stiffening of the body. So the child stiffens the body. Sometimes there is relax, with the jerky movement, they stiff the body again. There is periodically stiffening and relaxation, of the body. Then you can see a child, probably you are having discussion, suddenly the child starts staring, into space. That may be a sign of the seizure, especially when you're having a prompt seizure. The child may just start staring, looking at you, but it didn't really see you. Maybe staring into the space, and maybe if you're having conversation with that child, that conversation just suddenly cut off, and the child starts staring into the space. Some of them may present with lots of consciousness. The child not conscious and go into coma. Some of them may have breathing problems, or that they be sudden stopping of breathing. Some may present with loss of bowel, bladder control, and we notice that the child in the past visit doesn't have control over the way past visit, just past visit after when having this video, or you see the child wing on himself or herself. Some of them, they also present with sudden, sudden fall from no apparent reason. They just see that a child standing on his or her leg suddenly fall down just like that. And people start running, to attempt, to bring him up, what happened is that the child is having seizure. You can also see some of them, they are not responding to noise or words for a brief period. Especially those that start telling to place, just see that it's not responding to you. That is, you see some of them nodding their head rhythmically when associated with lots of awareness of consciousness. They will just be nodding their head. Some of them like that. Type of seriousness, you have salam attacks. They start nodding, bringing up their head while they are not responding and are not aware of their environment.
Okay.
And some may also present with period of rapid eye blinking and staring. They suddenly start blinking their eyes, frequently and rhythmically, and they are not aware of their environment within that short period of time. The lips may become tinted blue during time that some of them are having seizure. Some of them may have abnormal breathing, as I mentioned earlier, and some eventually they become sleepy after the period of the seizure, or become confused after the seizure. But what we should know is that symptoms of seizure may also mimic those of other health conditions. So it is important as a mother, as a parent, that when you notice some of these signs, make sure your child sees his or her healthcare provider for diagnosis of seizure. Seizure disorder is not something you take diagnosis at home and see the child at home. Please give the child the benefit of being a healthcare professional, which will make the diagnosis and give appropriate treatment that is necessary for the child.
Okay. Thank you so much, Dr. Kinola. This is 21 minutes after 10 right here on Women Radio WFM 91.7. My name is Rose Yusuf Kaiser, and this is the program Radio Doctor, your free health consultation program where real doctors advise real people. All right, Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free, advice on radio, and on your Women Radio 91.7. Today on Radio Doctor, we have Dr. Olufumilola Akinola, a consultant pediatrician at St. Ives Family Hospital, and she is consulting and advising on seizure disorder in children. Our phone lines are open. Do well to call us up on 07000 917 917. Send us a text or a WhatsApp message on 070 317 56537. All right, you have questions on seizure in children. You have experienced it before with your children. Please do well to call us. Let's get to hear how you went about with that and how you were able to deal with it, or how you're able to manage the situation as a parent. And you want the doctor to advise you concerning seizure in children. Please do well to call us up. Let's get to hear from you. 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. All right, so Dr. Akinola has been able to tell us what seizure disorder is, and she has told us some of the signs and symptoms of seizure in children. Now, Dr. Akinola, I would like to know, are seizures in children typically a sign of an underlying medical condition, or is just something that comes on its own, or something that happens just for itself? Because sometimes you have other illnesses that might come and they'll say, it's something that is causing it, it's another thing that is causing it. It's just like you're coughing or you're having headache. Now that could be a sign of so many other underlying medical conditions that might just be coming up. So but for seizure, are there typically underlying conditions when it comes to seizure in children?
Thank you very much. Yes, in most cases, seizure can be a sign of underlying medical condition. Which is now presenting as seizure as a symptom, sign of that medical condition. For example, seizure can be a sign and also symptoms of head injury. It can be a sign of symptoms of brain infection. Can be a sign and symptoms of brain tumor or stroke, and also can be a sign of hypo or hyperglycemia, that is adding of blood sugar, that is because of high blood pressure, and it can also accompany associated with brain infection or high fever. So, and also it can also be a sign of symptoms of epilepsy. And what is epilepsy? As I mentioned earlier, when you're having two or more seizures occurring in a patient without a known origin, so we can't really identify the cause of the seizure, but you know that this child is having seizure, and he has had one or two episodes, probably in his lifetime, without getting to know the cause. In that case, it is described that as epilepsy, that this child is epilepsy.
Okay. All right, thank you very much for that. So now, are you saying that it's possible that a child might have seizure 1 or 2 and, it might not translate to epilepsy? Or how does that work right now? So that, we're well aware that, okay, if this happens 1 or 2 times or 3 times with other, signs and symptoms, then we can say, okay, this is epilepsy. Or how does this get to that point?
I'll begin with example. Okay, for example, if a child is having a newborn child is having, and you take the test for the blood sugar, you are able to find out that this seizure is caused by hypoglycemia, which is a blood. Hyperglycemia, which is high blood sugar, can also cause seizure in newborn. So, if you're able to identify the cause, let's say because it's hypo or hyperglycemia, and like tendency, if you don't correct, the situation of correct with sugar, or you don't feed this child can go to hypo or hyperglycemia again, and we will result in having seizure at the second time. But because you have been able to identify the cause, we'll say this seizure is due to hyperglycemia, or this seizure is due to hypoglycemia. Sometimes in children under 5, we also have seizures that are caused with when the child has infection associated with high fever. So we describe this as febrile condition, febrile seizure. It occurs in children from age 3 to under age 6 months to 5 years because of their immature brain. The thermostat in their brain may not be able to set or be regulated with fever. When you have high fever, it triggers the brain electrical activity and result in seizure. So, because you've been able to identify the cause, you don't describe, you attribute that type of seizure to the cause. Maybe infection, maybe due to malaria, But there are some seizures that will just occur, and no matter what test you've done, you may not be able to identify what caused this seizure, which it will be easier for you to correct. And sometimes this seizure occurs repeatedly. So in that case, describe that this child is having a seizure disorder, or this child is having epilepsy.
Okay. All right, thank you for that, Dr. Akinola. This is Women Radio WFM 91.7, and this is the program Radio Doctor, where this is your free health consultation program where real doctors advise real people. All right, my name is Rose Yusuf Kaiser, and we are together with Dr. Kinola, a consultant pediatrician at St. Ives Family Hospital. Do well to dial in with the number 07000 Send a text or a WhatsApp message to 070 317 56537. Today, Dr. Kinola is consulting and advising on seizure in children. All right, so you have a question for Dr. Kinola based on our topic for today. Please do well to dial the number 07000 feel free to send a text message or a WhatsApp message to 070 317 56537. All right, so we are still talking on seizure in children. Now, Dr. Kinola, let's look at the treatment options for managing seizure disorder in children. Now, what are the different treatment options? Earlier, you mentioned even for a newborn baby, could have seizure. So, even starting from that, what are some of the treatment options for managing this disorder in children?
Thank you very much. In seizure disorder or epilepsy, or when a child is having seizure, the goal of treatment is to control, to stop, or to reduce how often the seizure occurs. In most cases, if we are able to know the cause of the fever, or the seizure, which I mentioned earlier, it will be easier for you to stop the seizure as soon as you correct what is causing the seizure. Especially a child that is having seizure due to hypoglycemia. Correct the low blood sugar, and seizure will resolve. Or a child that is having a febrile convulsion, if you are able to manage the cause of infection and bring down the fever, the seizure will disappear. But in case when you don't know the cause most of the time, what you can do is to control or reduce how often the seizure occurs. So treatment mostly is often done by medication. There are many types of medicine that can be used to treat seizure and epilepsy, which we describe as anti-seizure or anti-epileptic medication. So, and this medicine they are selected based on the type of seizure, the age of the child, the cost of the drugs, the ease of administration or use of this medication, and the side effect and availability of this drug. It is of no use prescribing a drug for you or a parent when it is not available, when it's not in the market, or the cost is too high for the parent to afford. They won't be able to be compliant with the use of medication. And this medicine, it comes in form of syrup, tablet, and capsule. Intravenous administration can only occur if the child is admitted in the hospital, where it can be monitored by the health provider. So there are some other treatment medication. Let's say if treatment option, if medication, in case medication fails, which includes, I may not be able to go deep into it, ketogenic diet, vagus nerve stimulation, and sometimes it may be necessary to do surgery, especially if the seizure or the brain disorder is caused by tumor in the brain. The tumor may have to be removed. Sometimes lobotomy may need to be done. So in order to help this some of children. sort of children
Okay.
to reduce, to control, or to stop their seizure disorder.
Okay. Thank you so much, Dr. Kinola, for that. Now, let's look at what triggers seizure in children. Are there specific triggers that can provoke seizures in children with seizure disorders? Are there some things that they should stay away from or not do? Are there some exercises that they should not be involved in? Are there some kind of foods that they should not eat? So let's get to know what actually triggers this.
Thank you very much, Rose. I'll start by saying that in children, due to their immature brain, especially children under 5,
Okay.
provoke seizure. It can be caused by many things, such as high or low blood sugar, as I mentioned before.
Yeah.
Can cause by head injury, can have infection with very high fever, very high blood pressure, stroke. It can provoke seizure. Kidney or liver failure can provoke seizure in children. And just I mentioned earlier, fever and also provoke seizure. Especially these are the known cause.
Okay.
But in people with epilepsy, in which you don't know the cause of the seizure, some of these seizure triggers, they have been recorded in such children include not taking medicine as prescribed. It is important that the healthcare provider and the mother of these affected children work together to ensure that these children take their medication regularly.
Okay.
At a specific, if possible, at a specific time of the day, and at a correct dosage. In which the health professional will work that out according to the weight of the child.
Okay.
Other things include not sleeping well, tiredness, stress, and in an older children, especially in teenagers, when use of alcohol and recreational drugs, and medication, can lead to seizure, especially when you have withdrawal. Then flashing or flickering of lights, when they're exposed to flashing lights, maybe at night, or they're exposed to flickering of light, especially watching, maybe especially when watching television, or where they can get access to flashing of flickering light. It can lead to seizure in those children. Other things include monthly period, especially in a teenage girl. This can be due to hormonal problem. And when you have missing of meal, kidney, leads to stress, leads to hypoglycemia, leads to that kind of things that can be, into seizure in a child that is prone to seizure.
Okay. Thank you so much, Dr. Kinola. If you're just joining us, this is Women Radio WFM 91.7, and it's about 21 minutes to 11 right here on Women Radio, and this is the program Radio Doctor. All right, your free health consultation program where real doctors advise real people. This is Nigeria's first specialized health program where medical doctors consult for free and advise on radio. Okay, this comes to you Mondays through Fridays from 10 to 11 a.m. And today on Radio Doctor, I have Dr. Olufunmilola Akinola, a consultant pediatrician at St. Ives Family Hospital. All right, and today Dr. Akinola is consulting on and advising on seizure disorder in children. Our phone lines are open. Do what to call us up on 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. All right, so we have a message from Charles Ihonre from Oregon, please. Okay. All right, Charles, I will definitely get in touch with you for this, okay? Thank you very much for sending in your message. I will get in touch with you. Okay, let's go ahead and, still ask Dr. Akinola, some more questions on a seizure in children. Now, Dr. Akinola, we've talked a lot about, how this affects a child, how this, is provoked or how this comes about, what triggers seizure in children. Now, let's come to the parents and caregivers. How can parents and caregivers effectively support a child with seizure disorder? Because at the end of the day, they are the ones who see how the child gets to react to this. So how do parents and caregivers get to effectively support a child with seizure disorder?
Thank you very much. For a child, a parent, when you notice that child has seizure, please, as soon as possible, take this child to see your healthcare provider.
Okay.
Where history shall be taken, examination, rate, and appropriate tests have to be done. Make appropriate diagnosis and type of seizure that this child has. And with that, we'll be able to know the best medication, depending on the type of seizure for this child. So the role of the parent at home now includes that and ensure that these medications are taken, at the appropriate time, at a specific time of the day, and also ensure that they are compliant with their drug. Then also it is important, let's be able to communicate with your child, appropriate age, what would I say, communication now, description, to be able to explain the diagnosis, of what is happening, to this child, so that we'll be able to give an open communication, so that anytime that this child is feeling, there's some that have, what do you call it now? They sort of have some premonition, that this seizure is coming, they should be able to come to you. Medically, we describe it as, if I remember, I'll bring it.
Okay.
I will bring it up.
Okay.
If they have, some of them, they have this premonition, having seizure. This is what I experienced before seizure appear the last time. So that you'll be able to know what to do. And then also, if anything is happening, seizure is happening, ensure that you lose anything, that may cause affect breathing, loose tight fitting collar, remove ties and remove tight cloth, and make sure that the environment, so that the child is free from hard objects, sharp objects, or water or electrical appliances that will injure the child.
Okay.
And if possible, keep bed away. And if a child that is having seizure,
you have 1 minute remaining.
From furniture, from sharp objects, from hard objects, so as not to injure the child.
Okay.
If it's available, you may need to use seizure alert monitor,
Okay.
For the child, so that when it's having seizure, it will alarm and and bring the attention of the parents.
Okay.
And also for those that are having frequent seizure, sleep in a room with others or place where others can hear when this child is having seizure.
Okay.
And remember to keep.
All right. Thank you so much, Dr. Kinola. We seem to have lost connection there. We will definitely get to have her back so that we can hear the rest of the advice that she is giving to parents and guidance, to have them take care of children who actually have a seizure. So thank you so much, Dr. Kinola, for staying with us on the program. So you were just giving advice on what parents and caregivers can do.
Yes, and also remember to keep electronic device from the bed, or from the area where the child is having seizure, so as not to injure and cause electronic shock. And also I want to advise, we've seen a lot of cases when a child is having seizure due to probable ignorance. You see this child, they are putting their legs on stove or fire to burn them, thinking that will stop seizure. And we've seen several cases in which even after stopping the seizure, for months we are still treating the burn injury that the baby or the child has sustained. So fire does not stop seizure. Some will put herbs, some will put pepper, dry pepper into the eyes, of these children when they're having seizure, thinking that will stop seizure. Please, that is not advisable
At all.
We've seen many children losing their eyes. They cannot, even after stopping seizure. Most of the time, to tell you the truth, seizure will stop on its own. Either you give medication or not. But it's when you're having repeated seizure, quickly go to the nearest health facility. They know how to stop that. But putting pepper, putting something into the anus, putting the legs onto the stove or burning fire, cause more harm, than good. And also, when a child is having seizure, it is not transferable. Doesn't mean that when a child is having seizure, especially in schools, in a public places, in church, you don't need to run away from that child. It is not communicable. It won't be transferred to you. It won't fly to you because you are in that environment. It doesn't mean that when you now get home, you start having seizure. It is not like that. So please give help, and one of the help that you can do is please clear the environment, remove sharp objects, knives, electrical circuits, hard objects away from the child, things that can injure the child or an adult that is having seizure. If possible, put the child on his left lateral side where it can be easy for the child to breathe. Remove loose clothing, remove ties, remove anything, tight collars, that can be an obstruction to breathing while you wait for the seizure to stop on its own. And despite that, if the seizure still occurring, quickly find transfer that child on an adult to the nearest health facility where they will give a drug or medication to stop the seizure.
All right, thank you so much, Dr. Akinola, for that. Now, I was going to ask, there's some practice that was saying that, sometimes when we even see adults having seizures, they get to put spoon or get to put any kind of metal in between the person's teeth, so how far does that go? Is that even supposed to be a way out?
That one also include part of what I was describing earlier. Use of sharp objects in the mouth, use of spoon, use of knife, use of fork. Putting it into the mouth, it does not stop seizure. We've seen some of them, they cut off the tongue just because they want to stop seizure. They use sharp objects to injure the tongue. So after the seizure has stopped, we now start nursing, the injury on the tongue or the mouth. And some of them is so severe that the child for weeks won't be able to eat on its own. They have to be placed on IV drugs, and it increased the hospital, admission, the cost, and a lot of things happen. So all those things are not needed. These are the steps that you should take.
Okay.
When you notice a child that is an adult that is having seizure, first clear away the environment of sharp objects, knives, electrical devices, hard objects that can injure the child. And if possible, if it's on a hard surface, try to move, to somewhere soft, probably on a move to a bed which is softer, so as not the child so that it won't injure itself while it's darking. Then put the child on the left or an adult, if possible, if you can do that. Remove neck ties, remove tight collar, and you may lose the cloth so that there won't be obstruction, so that ear exchange can easily take place. Then put the child on left lateral side.
Okay.
It will be easier for ear exchange to take place. That's the best you can do. Giving all those pepper, putting legs in the water, pouring water, it doesn't stop seizure.
Okay.
So, and most of the time, within less than 5 minutes, most seizure will stop on its own. Except you are now having recurrent seizure or epilepsy, or what you call status epilepticus. So for those cases, maybe if they stop, they start again, and take them to the nearest health center. Just make sure that there is nothing obstructing the mouth. Most of them die because there is obstruction. Something obstructing the mouth. Some people even put cloths to the mouth so that they said that when they close their teeth, they will die. That is not true. Sometimes what you put into the mouth, to plug the mouth, it even works through them when they can't exchange, when they can't breathe. So just ensure that there is no nothing obstructive. And when you put them on left lateral, it makes sure that the tongue is not obstructing the airway, so that they can breathe freely. Then take them to the nearest hospital.
Okay. Thank you so much, Dr. Akinola. Thank you. I was going to ask for, your final words and your advice, but it seems as if you have just given us, all of it. Or is there something you would want to add that you want parents and caregivers to actually take note of, when it comes to seizure in children?
I would still say that seizure is not contagious.
Okay.
It's not a communicable disease, because someone is having seizure. When you touch that person, you start having seizure. No, please, when you notice someone having seizure in your environment, do as much as possible to help to save the life of that person. What you have to do is very simple. Ensure there's no tight clothing. Ensure the patient is breathing well. Ensure that there's no object that will injure the person in the environment. Put the child, the person on a soft, maybe if you have access to bed rather than on the hard surface that will injure the skin or whatever thing. And ensure that the person is breathing properly. Now put on left lateral side, and as much as possible, if there's nothing you can do, this seizure didn't stop, take to the nearest health facility. They will know what to do.
All right. Thank you so much, Dr. Akinola, for consulting with us today on seizure in children. Thank you so much for being a part of the program.
Thank you for having me.
All right. Still have a great week ahead.
And you too.
All right. Thank you. All right, so a very big thank you to Dr. Olufumilola Akinola for today's free consultation and advice on seizure disorder in children. Dr. Olufumilola Akinola is a consultant pediatrician at St. Ives Family Hospital. And thank you too for listening and for actually taking all of these things and using it so that at the end of the day you can be healthy, your loved ones will be healthy too. All right, so Radio Doctor on Women Radio WFM 91.7 is Nigeria's first free consultation specialized radio health program, broadcast Monday through Fridays at 10 a.m. Do also join us again tomorrow at 10 a.m. for another episode of Radio Doctor. A very big thank you to the producer of the program, Mr. Larry, and the executive producer, Tom Okewale Shonaya. My name is Rose Yusuf Kaiser. Good morning.
WFM 91.7.